I'll kick it off, just so that we get into it. And maybe we'll start with you, David. When we had a chat before the conference, one of the stories that I was most interested in was a story that you told me about a big project that you did with Kaiser Permanente while you were still at Samsung, a pretty long project. And the reason that it caught my attention was not only because the breadth and the depth and the innovation of it, but also the results, right? And one thing that is very important for us when we are getting excited about virtual health and about the next generation and everything, I think that to make it, I know people really need it right now and they're seeing the value in it, but to make it sustainable, we need to make sure that it actually has great returns, that society sees it as something sustainable, right? That it not only is more convenient and easy to do, but it actually adds a tremendous amount of value in multiple ways, both in quality and cost, right? So maybe you can share with us some of the details of that project, David, because I thought it was super interesting.
Yeah, thank you, Ron. And just so, when people think of virtual health, it's oftentimes discussed in the context of a virtual visit, where an individual has set up some time to speak to a clinician. And there might be some element of remote monitoring that occurs either during that visit or perhaps sometime beforehand. What we were thinking about was all that intervening time that happens in between those visits. And more importantly, even outside of a visit, if you think about programs that are run today, many of these are in-person, in-facility type of programs, such as cardiac rehabilitation. And what we wanted to understand was, does it require that the physician and the patient be in the same building at the same time for a prolonged period? And if you think it from the perspective of the physician and the clinician, it's convenient because the patient comes in to your facility at scheduled time. It's highly efficient. From the patient perspective, it's very inconvenient, especially if you're asking them to do it 3 times a week for 30 minutes or an hour for like 6 to 8 weeks. And what we had seen is a very important program such as cardiac rehabilitation is nationwide has a completion rate less than 50%, which means that less than 50% of the people who actually are recommended for this treatment will complete it. The unfortunate thing is that 50% of people, a good number of them will die because of that. There's a number needed to treat anywhere between 7 and 17. So for every 1 to 17 persons that doesn't complete it, they will die. And that is a really powerful thought because, why have we created this program? We created it because it was something that we just, in many ways felt was the only way we could do it. With digital tools, we could actually now sort of re-envision what that program could look like. And so talking to many of the cardiologists across the country, we learned that the program itself is not what most people think. I even myself as an internist, I thought these were patients that were, many of them had heart attacks. They just, so if you have a heart attack, oh my gosh, you're going to need an EKG monitor. You're going to need somebody with a defibrillator, especially if they're going to be exercising or doing any type of strenuous stress to their heart. So I think that was sort of the perception, but the reality is most of these are low risk patients, very low risk for arrhythmias. But the recommendation of continued exercise is so important. And then the ability for, we'll call it a coach, to be able to work them through a 6 to 8 week program in coordination with taking your medicines and being able to understand all the different things that could be done is something that could very easily be done with a digital tool such as a smartwatch. And so that's where we started landing on, could we take a form factor that was easy to use? The only thing that we would ask is that you wear it and charge it every day. That's it. Then what would happen is you would be asked to walk. You do what's called a 6-minute walk test, and you exercise, and then you do a cool down period, and then it measures your heart rate, and it does all these kind of things that would be very helpful for tracking. And then as part of that program, what we learned, it looks like we've got
Vanessa, this is what I call a great technology hack. We're going to love it, right? All the technologists in the panel are just like smiling big time. I haven't seen a big smile like that. Hi, Vanessa.
Can you see me? Can you hear me?
Yes, we can see you. We can hear you very well, and you look wonderful. Thank you for joining us from Geneva.
My pleasure. Well, it's a good thing that you can only see the top part. The rest, I'm certainly in my yoga pants, like everybody else.
Yeah, yeah. Sounds familiar. The sign of times. Thank you for joining us. It's late your time. I really appreciate it. Vanessa from Geneva, and I should have mentioned that Paul is in Vienna. Is that true?
Yes, close by to you, Vanessa.
Okay, so we have Vienna and we have Geneva on the line. And sorry for interrupting you. David was in the middle of telling us the story of their collaboration with Pfizer. So go ahead, David. Sorry for interrupting.
I was just laying the foundation for perhaps maybe the conversation that we want to have, which is around how virtual health is not just about a visit, but it's around taking all the things that we traditionally think of today as being things that require an in-person visit, and a program would be a good example, in digitizing that. And what we learned, to cut to the chase, is by implementing this, and we work closely with KP, Kaiser Permanente, is that we were able to demonstrate in the first 230 patients reduction in the readmission rate. Well, I should say first, the completion rate for the program went from mid-40s to mid-80s. Getting a lot of background noise here.
I think that, yeah, you need to mute. Yes, thank you, Jillian. You can mute while, because I think that you're getting feedback. Yeah, go ahead.
Okay, so the first thing is that we saw the completion rate nearly double. And as I shared, that means for every 7 to 17 patients, you're saving a life. So that's great. And then the second was that we measured the economic return in terms of readmissions, and we saw the readmission rate for this group of patients that had just experienced a heart attack go from around 12 or 14% to less than 1%. So then the next question was, well, that was only 230 patients. What if we went to 1,200 patients? And then when we roll this out, similar results, same level of adherence. The readmission rate bumped up slightly to like 1%. And so what we realized is that this actually is a highly effective program. And not only is it something that should be done in this pilot, but the KP leadership, this is during the time when pre-COVID had recognized that this needs to be our standard of care. And so now they're rolling it out across all of KP. So I think that there's a couple of lessons learned. One, that you don't need to have an in-person visit, and a program can be digitized. It's highly, patients love it. It can be highly adapted, and you can have some great clinical and economic returns on it.
That's awesome. Thank you for sharing. I'm going to leave you guys and let you continue the panel now that we have Vanessa. I just want to highlight, this is all about nascent technology. That's what we're talking about. But, people know how to work around it. And then as they're fixing everything around to create these amazing opportunities to all of us, super relevant to what we're talking right now. Thank you very much.
Great, and thank you, Ron. And David, I was fascinated not just by the project that you're describing now, but also by your path up until now. And I think we've talked a couple of times before. And what you were describing is actually a very good segue to perhaps ask Sean from his experience with HealthTap. And HealthTap came about at the time where HealthTap came about. There weren't that many options out there that were really pushing very hard for very wide access to telemedicine. So it came at a time where it really, I believe, it helped increase the access in a new way. So Sean, do you want to tell us a little bit about that and what has contributed to the success of HealthTap, and how do you see the different tools and responding to the needs from the consumers in wanting to have a digital access to their own doctor, to their own physician?
Definitely. And you'll hear me pretty much echo exactly what David said about, removing unnecessary doctor visits and doctor time out of the equation solely, right? It's not just about the virtual visit. So, since this panel today is about lower costs, I think it's important to just start with a high level. What drives lower costs with virtual care and digital health? I think it boils down to three things. One is adoption. Are people actually using the app or the tool or the service? Because if they're not, it doesn't matter how great it is, it's not going to save costs. The second is efficiency. So how well does it match supply and demand cost effectively? And here I use the term supply and demand abstractly, because sometimes you don't need to match demand with doctor time, as David was already saying. And then the third is outcomes, right? So does it actually yield a better result for the patient's health? And I think on all three pillars, HealthTap was somewhat fortunate with the insight in its origin story, because 10 years ago, you have to transport yourself to a time before digital health or telemedicine, because that was an age of Google and WebMD and just some very nascent websites that were publishing online health information. And there really weren't iPhones and Android phones and apps. And so back then, the consumer behavior, whenever they were sick or had a question, started with Google. And guess what? And 10 years later, that really still hasn't changed. And so when you have a symptom, a pain, or a question, one of the original insights HealthTap had were people are going online, not to their doctor's office. And they were doing that because, well, before they decide they want to see a human physician, they want to self-educate and self-orient. Is this serious? Should I be worried? What could it be? And I think we can all anecdotally agree in our own experiences that going online often leads to more anxiety and misinformation and confusion than when we began. And yet that's what people want. In fact, when you look at the statistics, people go to Google for health information almost 20 times more than they decide to go see a doctor. So we're talking about something on the order of 10 billion Google health searches a year versus 500 million doctor visits a year. So here's a behavior consumers are doing frequently. The experience is fairly broken. So how do we fix it? And that was where HealthTap's original insight came. And that helped with the first pillar of the equation, which was adoption, which is if we could build a tool that gave people health information before they decided to see a doctor, that 20 times more frequently than they actually decide to see a doctor, well, then you're getting them in the door. Then you're getting them to engage in a digital forum where then you can then navigate them intelligently thereafter. So HealthTap had an interesting approach where we decided to take a lesson out of the book of Quora or Stack Overflow or Yahoo Answers back in the day is probably the more contemporary analog. But can we crowdsource expertise from doctors? So take questions in from people and match them with trusted peer-reviewed answers from a volunteer doctor network. And it worked incredibly well. So we ended up creating this repository of, essentially think about it as the world's biggest FAQ database of consumer health questions and doctor answers. And that became an amazing alternative to going to Google. But to summarize the answer about both their evolution and how we lower costs, the second aspect was about efficiency, right? So how do you effectively match supply and demand? Well, here the demand is, I have a question or concern, I'm worried, I don't know what it should be or what I should do. A good percentage of the time, you can address that demand with information. You know, there's some stats out there that say half of all primary care visits are purely informational. There was no physical exam. The physician didn't really need to see you, touch you. He just needed to answer your questions, which you had top of mind. Well, crowdsourcing Q&A, an instant database of peer-reviewed doctor answers is one way of efficiently matching that demand with essentially free server machine work right in the cloud. It's just serving you an answer that a doctor gave someone like you in the past, or crowdsourcing it from volunteer doc network. Layer on top of that some intelligent AI guidance of, okay, based on your symptoms, I think you should go to the ER, or no, you should do a virtual visit, or no, I think this is a common cold and you can probably take care of this yourself. Layer in the fact that you have virtual visits as another final step before actually going and seeing a doctor in person. And all of a sudden you have a broad spectrum of ways you can meet that demand with lots of cheap, automated, scalable supply. And then finally, on the third piece, the outcomes piece, you know, the result is not achieved once you receive the doctor's orders, right? You have a script in hand and some discharge instructions. That doesn't mean your pain went away. So I think any good virtual care tool needs to stay with you after the instruction or guidance and help you with actual adherence. So that was another insight we had, which was to really create an end-to-end journey, drive the adoption at the top of the funnel by giving people information, effectively and efficiently match their demand with the most efficient supply, which is sometimes self-help informational tools like a symptom checker or a Q&A database, and maybe virtual visits. And then after the visit, make sure you're sending them reminders, making sure the instructions are actionable and clear. Make sure that the guidance you're getting, first of all, is accurate. And there's ways you can do that both with AI and peer review that help with that as well. So I think that's the framework that we use at HealthTap to think about it. And hopefully that is helpful in thinking about other digital health tools and virtual care solutions that are out there.
Yeah, you're absolutely right. And I really appreciate the fact that there is an emphasis on outcomes, because the last thing we want is to digitize a care pathway just for the sake of the efficiency of the system. Yes, you may reduce the cost, but then you have everybody unhappy and not wanting to use it, so you won't scale. So I really think it's a message that we need to continuously be drilling down to, which is we're improving the efficiency of the system, we're increasing the access to care, but for the benefit of the outcomes that matter to the patients. And so I think it's very important to keep on bringing that back in, because ultimately to have the healthcare system functioning for the benefit of the patient, not just for the benefit of the system, right? And so, Paul, this brings me to you. As Flex has a different set of products, it operates in different industry segments, but it also has a function of platform. And so, do you want to tell us a little bit from your experience there, what you've seen in solutions that have worked to increase access through digital tools?
Yeah, thanks for the question. That's I'll connect to what Sean said. We have a large number of people in the company, and we are also operating ourselves in the healthcare space, even in areas that we have not thought about before. In this crisis, we started to produce masks. Yeah, we are just celebrating today that we produced our 4th million mask. Wow. And we actually need them very much for our own people, but also for the communities that we are donating to. But yes, we are a user as well, and we're actually a very happy user of HealthTap. What has been the biggest improvement for us over time is that people see the benefit of having digital connected information. So initially, we were going through a first wave of changing people's behavior and making them comfortable of using a digital health solution, but then connecting the information that we have stored in HealthTap that helps people to have a better healthcare experience. And if you look at the challenges of today, especially on Corona, a lot of that is, again, having that connected platform that helps people, first of all, being comfortable with a user interface to use it, but also having background information of do they have any kind of precondition that they need to be careful of. When you go then into the screening, people not normally think about having a light symptom or something about could it be something that is connected with COVID. And so still today in our factories that are currently impacted because the surroundings are still heavily impacted by people being infected, we have to go and check with people in the factory if they show any symptoms, if they could potentially have COVID. We have to go through temperature checks and all of those things. And having an integrated solution is very helpful here, because not only can we help people with an automated way of going through their own screening, through creating their own awareness before they put themselves and others into danger, but we also can directly put them into the direction of the right care path that they should take. And it helps people to feel more comfortable about having an all-in solution that they can rely on, as well as a solution that they can bank on for their next steps in the treatment. We did surveys internally in the company to see what people are most afraid of, and many are afraid of, they feel a light symptom, they're afraid about talking about it because they don't know what will come next. And having an integrated digital health solution like HealthTap here is super helpful. We are talking now about Corona because it's a very actual problem for us and the world right now. But we had similar challenges in the past, where we had, for example, a flooding in one of our locations, where suddenly 5,000 people could not go to a doctor anymore. And again, HealthTap was here to help people instantly and answering their most important needs, being a trusted platform that they could go to, understand that they get expert help from certified doctors, and they get help with having a created Q&A that they feel comfortable about getting the answers that they need to secure their own health, but also to secure the health of their families.
Yeah, well, that's amazing. And thank you for sharing that. Being in Switzerland, I'm very mindful of the time, and I want to make sure we finish on time. So we have 3 minutes, and I would ask each one of you, so where do you think the biggest promises are coming from in terms of the digitalization of the healthcare system? Maybe starting with you, 1 minute each. David, from your side, where do you see the biggest promises coming for the future of increasing access to care through digital tools?
So one thing that I've noticed is that there are many great applications and tools, but if they're not all connected on a digitized platform, it's very difficult for organizations to do anything at scale. And so what we're seeing now is that there's a significant effort at, I'll say, a country and global level to try to figure out ways that we can address that infrastructure change. That to me is going to be transformative. And that's one of the probably the silver lining of all this. It's forced many of these organizations to sort of rethink what is the infrastructure needed to not only handle a pandemic, but also to handle all disease.
Yeah, absolutely. Thank you. Paul, where do you think the biggest promises are coming for the future?
I agree with everything that David said, and I would add to that people feel more comfortable and trust more in digital platforms, and therefore faster change their behaviors. That's the biggest bottleneck I would have say we have seen in the past. Changing behavior is most important.
I would 100% echo the sentiment. I think it's all about.
What do you think?
Oh, yes. I think it's all about the connectivity. We're living in a world of a lot of point solutions, different apps that do different things. And I think it's the difference between what we like to call at HealthTap, a unified utility versus fragmented futility, right? And so I think if you can combine everything consumers need in one connected, seamless flow and experience, you find that each and every one of those individual experiences are not only more effective, more personalized, but they're also more engaging. And I'll leave just with one very interesting data point. You know, a lot of folks right now are merchandising things like a symptom checker and a telemedicine tool and a remote monitoring solution. And, you know, this was a really great panel to be alongside Paul, because in the population that we work with for them in their US workforce, we found that when you put the Q&A informational tools along with AI symptom guidance tool, along with a virtual visit, along with adherence care plan tracking, you get, even for the virtual visits alone, synergies in engagement and adoption and cost savings. So with Flex, for example, with their employees, we saw 9 times more virtual visits than a traditional telemedicine solution, because again, going back to the insight, when it's in the same app as a tool where you're getting information, one flow leads into another. And I think the question will be, in work that, you know, folks like David do with Kaiser, how do you incorporate remote monitoring and proactive alerting in the same place where you get virtual care, in the same place where you get information? And I think that's the vision we need to go towards.
Absolutely, and how to get all of that as a easy experience for the patient, all of it integrated in one care pathway with one reimbursement system. That would be the dream, and one that respects the data privacy and that always asks for consent of the patient to use all the data that is being generated. I see a bright future for the digitalization of healthcare. Thank you for bearing with us, particularly with our connectivity issues here. But I think this has been a very useful conversation, and I hope you'll continue to enjoy the rest of the festival. Thank you, Jillian.
Thank you.
Thank you, Paul.
Thank you.
Thank you, everybody. Vanessa, thank you so much for joining us, and Jillian, thank you very much for bringing basically Vanessa into the conversation. As you can see, like, you know, when you use multiple technologies, it's also, you get all kind of other things that happen in between. So we experienced in real time, real innovation on the fly. And I told my team several times as we were building FestiHealth in the past 3 weeks that sometimes building technology is like flying a plane, building a plane while flying it and with passengers. So, you know, I think that that's all of you can easily resonate with that sometimes. And I really appreciate the fact that you're here. There's a lot of promise to virtual health. And what I'm most excited about is to see that there are examples already out there that are able to show over a long period of time that there's value for individuals, there's value to organizations, there's value to the healthcare system, as well in virtual health, beyond just the convenience and then the value is added to people's health and well-being, to the longevity, as David mentioned, saving lives, which I think it's a very important part that we need to measure, because this is the real impact, the deep impact on outcomes, right? Is saving lives and improving people's lives, but also on the bottom line, because as a society we want to make sure that it's sustainable. So thank you so much for joining us. It was a delight. Thank you to Vanessa for joining us from Geneva, Paul for joining from Vienna, and for Jillian for teleporting.
You can fly across the ocean, right?
Thank you so much.